So, hey guys, this is now back with more midwifery revision questions. So, the question is asking list 4 indications of induction of labor. So, what is induction of labor? This is like a method of extending or initiating labor um by artificial means. Like labor is not occurring now spontaneously like it should. So you give something like a drug, or you do something to initiate the labor. So the indications of labor. It may be during prolonged pregnancy. Prolonged pregnancy is a pregnancy that exceeds 42 weeks. Now you went to hospital, you're waiting for the water to break. You're waiting like for the contraction to initiate, but there's no contraction, and you're past the due date. So the doctors said to induce to induce the labor artificially. Then also the women who go to hospital and they have maybe a pre-eclampsia. So to prevent, that at that point, pre-eclampsia is treated as an emergency because you don't want to strain the woman. Pre-eclampsia is like a type of hypertension that result during pregnancy. So that also could be an indication. Then the woman who has diabetes, also induction of labor might be happen because remember diabetes it increases the high risk of giving birth to a macrosomic baby. Then we have also the causes when we have oligohydramnios also is another indication. Then we have also premature rupture of membrane when the membranes are ruptured prematurely. We induce labor to prevent, because now when the membranes are ruptured, we are giving a leeway for the infection to arise. So this might cause what we call puerperal sepsis or chorioamnitis. So to prevent that, you induce labor. I think those are the causes that I know, the indications that I know. Also, the other one is maternal request. When the woman is trying to escape the natural process of pushing and the pain, anasema sitaki kupitia hiyo, so she decides to she tells the midwives or the nurse, please, I need you to induce labor, maybe by giving the drugs, which I'm going to talk to the next question. Yeah. So in summary, the indications of induction of labor, we have prolonged pregnancy, we have hypertension, especially in women with preeclampsia, diabetes, prom or premature rupture of membrane, maternal request, oligohydramnios. Also, when an addition is fetal anomaly, or where we have the fetal anomalies, or fetal where you see that the fetus has no like signs of lives or fetal death. Yeah, okay. The next question is asking, explain 4 methods of induction of labor. So when now we are presenting with these indications, like let's say prom, let's say the mother is requested to be induced, or maybe doing prolonged pregnancy. What are the methods you can use to induce labor? The first one, which is the actually considered at first, is what we call cervical membrane sweeping, or is it a CMS? So this is when now the midwife for the nurse enters with the okay the fingers into the vagina, and now into the and reaches the cervix, and turn out to separate the cervix from its attachment to the decidua. So this separation, of this detaching of the cervix of the cervix, it results to what we call the release of prostaglandins. And yes, prostaglandins. And what is the function of the prostaglandins? It is stimulate uterine contraction. So the CMS is considered first because you avoid the need of using drugs or using using drugs such as prostaglandin. So the second method of inducing labor is by administration of prostaglandin. Example of the drug of the prostaglandins you can use is misoprostol or dinoprostol. That is PG. it too. So these drugs can be given intravaginally or orally. So the function of these prostaglandin, the best thing about them is that they soften and also ripen the cervix, and also they stimulate uterine contraction. The third method of induction of labor is what we call the oxytocin infusion, and this oxytocin infusion is given slowly IV. um, Mostly it's given 5 or 10 international units. um, the function of oxytocin also is to stimulate uterine contraction. And then the fourth method of induction of labor is what is called ARM, the artificial rupture of membrane. Now the woman wants to escape using, ataki kudungwa dungwa ama madawa, so anasema yeye like tutoboe the ama to rupture the amnio sac artificially. So this is mostly used when women do not the pregnant women or the women in labor don't prefer taking prostaglandin or oxytocin, because also the drugs, they come with a side effect. The side effect, yeah, na ni chungu pia. Mesikia women, I've had like stories of some also stories people saying like that your sindano inaitwa Sinto, it's so painful. I don't know. Yeah, but they say, yeah, that's your injection, your sindano ya oxytocin ama symptometrin is so painful. Okay, nikaja kujua it's called symptometrin, but they call it Sinto. Yeah, okay. So yeah, so artificial rupture of the membrane is when now the nurse use what we call an amniotic to kutoboa the amnio sac. So this one also helps to hasten, it's like a method of inducing also labor. Those are the 4 methods I know. So the cervical membrane sweeping, prostaglandins, then you have oxytocin and ARM, artificial rupture of membrane. That is the whole question, and the answer to that question was 8 marks. So the question was asking you, you list 4 indications of induction of labor, and and then you describe 4 methods of induction of labor. I think I've answered that question. So if you have any other question that you want me to like share, you can put that in the comment section. Till next time, adios.